We all came back as basically immigrants. What is anatomy? It's relationships.
Why do you think there's so much judgment?
They want to fit in with something either externally or internally.
Welcome to part 2. Why silicone?
So silicone implants have gone through a long history in the US. I won't bore you with the details of it, but in the 1950s they were kind of basically invented. Actually at Baylor, where I trained.
Oh, okay.
The very first one was developed at Baylor.
Lots of stuff coming out of Baylor.
It's a really cool story. But ultimately, the silicone implants are better able to mimic breast tissue, which is what you're trying to do. And so one, mimic breast tissue, but two, let's get our numbers right. Two, deliver structure to the breast. Okay, a lot of people need structure. Volume goes without saying, but structure is a big deal, and these gels are engineered to deliver that. The gel is it's a hybrid between a solid and a liquid. And it has this property that's basically this elasticity that gives structure. So when you're trying to engineer the upper pole of the breast, which a lot of women lose, maybe they don't have naturally, or they lose over time with family planning, nursing, childbirth, you want to build that back up because they desire to have this because they probably had that beforehand. And it's a huge part of femininity for a lot of our patients. And so when you want to build that back up, a silicone implant will give you that because on the side, it stands up. As you can see. And a saline implant saline is water. It's a pure liquid. And so it will only take the shape of what you put it in. Like water in a bottle, the shape of the bottle. In a saucer, shape of the saucer. And so it has no inherent structure. So when you put it in the human chest on the breast, that water will tend to give and fall to the bottom of the implant and not support as much. And then it'll tend to move a lot when she moves around and actually make that pocket wider over time because it's more volatile in a sense, or less viscous, I would say. That's a better term than silicone. So silicone by far is the preferred choice.
The best. Okay.
There was a scare for a while with silicone. So in the US, for cosmetic patients, we had a 14-year period, 1992 to 2006, when the FDA put a moratorium on silicone implants because there was a scare from a big expose on the news that someone said, hey, I think this causing problems. And media took and ran with it, and it got us all in trouble. And for a decade and a half, the FDA studied these implants intensively, and they lifted the moratorium in 2006 because they found no association with some of these autoimmune issues.
Well, that's good.
Yeah, but it performed way better. So it's a clear choice.
So someone talks about gummy bear implant.
Yes.
They're referring to cohesive gel silicone.
Yes, right? Yes. So that's a good term. So gummy bear implants was at one point was an innovation, a new thing in plastic surgery. So pre-gummy bear implants, a lot of silicone implants were designed to be very soft and less cohesive. And why would they do that? Because it was felt like that was softer, more like breast tissue. The problem with that design is that if there was ever a problem with the implant shell, let's say a rupture, and you always probably see this in radiology.
Yeah, and that's why, I brought that up. Yeah, that's important in my field, right?
Yes, exactly. Yes. So implant, if you have a runny silicone gel, that could in theory run out of a ruptured shell. And in theory, get into like lymph nodes and migrate into lymph nodes and get into the body, get systemic actually. So also someone figured out, hey, what if we make them more cohesive? And that was released in the reconstructive space first. And it became more widespread. So it's almost the way you look at, so things like, I think of like things like seatbelts. Okay. At one point, one company said, hey, let's do seatbelts. And it was like, oh, that's a good idea. Oh, even better. When you put your car in reverse, that camera in the back, at one point that was a novelty.
Right now,
Yes, so now
I don't even know how we lived without it.
Right. So now gummy bear is ubiquitous.
Yeah.
Most silicone implants sold are gummy bear, but at one point it was a novelty, like the rear view. Oh, I have a rear view camera, that's so cool. Now everyone has it.
Now everybody,
So gummy bear is now universal, pretty much.
It's a cohesive gel, meaning if you cut into it, it doesn't run.
That's correct.
Because I still see fortunately, on some mammograms, older ones, where they have been replaced with a gummy bear, cohesive gel implants, but you see extravasated silicone on there.
Yeah, I saw that on Monday actually.
Yeah, and for the most part, it's pretty clear, but there are some situations where it kind of confuses the picture, what's happening here, right?
Yes.
So yeah, I actually did one on a lady that had that, and I did a biopsy on it, and there was a malignancy there, but it was a struggle. Yeah.
Do you perform final aspiration on peri-implant fluid? Do you have? Yeah. I saw someone recently who might need that actually.
Yeah. It's funny. I just did one for a plastic surgeon because we were thinking of BIA.
Yes, ALC. Yeah, sure.
Yeah, I did do that.
I saw someone recently. She had her surgery abroad actually, but she has implants fluid, peri-implant fluid.
Depends on how much.
MRI diagnosed. Yeah, if it's thin.
If it's a little bit, it's fine. In this situation, she had it abroad as well. They were textured implants. She had an MR. I mean, there was definite fluid, and the cytology came back as negative, but it's gonna have to come out anyway because But I do that.
And was it late onset, unilateral?
It was unilateral.
Late onset, surgery years before this.
Yeah, she had it a few years prior. Yeah, interesting. I've diagnosed that a couple times with.
Oh wow. Yeah. It's
the one lady that did have it. I think I took about 300 cc's of fluid off. Yeah, so we're talking about BIA ALCL, which is a condition that you get with textured implants, not with smoother implants.
Very true.
Which is what brings me to this question about Motiva implants. It's not something that we use in Canada. I know that they are. Well, I don't get your thoughts on it. They're considered micro-textured or nano-textured, but they are textured. And in my head, as a radiologist, not just as a radiologist, but as an individual, I think with the problems we've had with textured implants, why would you as a plastic surgeon suggest for somebody to use Motiva versus another implant?
Yeah, so I'll start by saying I'm not a spokesperson for Motiva.
Yeah, this is not sponsored by
Motiva. Sure. I am a spokesperson for my advocate for my patients, and as such, my prospective patients as well. And as such, my duty to them, I'm duty bound to my patients to evaluate the space, like basically the back end of plastic surgery. That includes devices, that includes implants, that includes equipment, and present to them the best available options to get to their goals, as described to me in our consultation, which are usually in depth. So when a new product comes on the marketplace, my job is to research that and figure out if it makes sense to present that as a potential option to my patients. So we're discussing a new implant company that came on the scene in the US officially in March, roughly March of 2025 after some research. The company is called Motiva, and they have a suite of implant products that I've placed in a number of patients, probably 20 or so in the past few months. And so why are we presenting this, and why is it different from other products? The main thing you mentioned is the surface characteristics of the implant's coating. And so if you touch that implant and feel it, you feel what the company calls a smooth silk surface.
Yeah, it does feel smooth.
And so that surface has a very specific kind of dimensions to it. So it's 4 nanometers, the interstices on it. And it turns out that when you have, according to studies, when you have an implant placed with that size interstices on it, that the skin cells that make collagen are, for reasons unclear, kind of quiet, actually.
Okay.
As opposed to more inflammatory in nature, which we see with other types of surface characteristics. Even less so than so-called smooth implants.
Interesting.
Somewhat surprisingly. So the FDA assessed all this and felt compelled to say this is different than what we're used to calling textured surface. It's not intuitive, but that's what the studies show. And you see less of a capsule response, actually. which is
I was going to ask you that. So when you say less of an inflammatory response, I mean, the body's going to form a capsule around it
yes,
anyway.
yes,
Are you saying that the capsule is thicker or
Thinner.
or thinner? Okay.
it's thinner, it's softer and thinner. So, and they've corroborated with some of their prelim studies showing that there is a somewhat lower incidence of capsular contracture,
Right.
which is in the US to us is a good thing to hear because capsular contracture is a drag on patients' lives and on practices because you have to, do secondary surgery. The companies also they typically will provide warranties, so they pay as well for CapCon. So everyone kind of feels that heat of CapCon, and every practice has some non-zero incidence of capsular contracture. It's quite low in our practice, but it's certainly not zero. So if anyone says I'm decreasing this, there's a captive audience ready to listen.
Right.
So the way I frame this company's products, like most things in medicine, I tell in my practice I offer, in theory, all four manufacturers. In reality, a couple more commonly, but we're open to patients' needs. Certainly, I certainly have my inclinations and my recommendations, but I tell patients, listen, we have this new product. The FDA says it's good, which says a lot because FDA is very strict and is very credible. But medicine is medicine, and things can change on a dime. So we have other products we've offered for longer. They've been here for 20 years, and American patients. I'm talking about anywhere else. There's great stuff in Asia, there's great stuff in Latin America, Europe, but those are different demographics than American patients. So there might be things that we're not seeing with some of these studies. The newer companies, we don't have as long a track record. But to not show people that this exists is a disservice to them. So we present the option and say 20-year track record and world-class results either way, because I show them before and afters. We've had great results with the other companies, with low complication rates. So there's not like a crisis here. But there is a new product that could be super great. We see great results now, but it's a shorter track record. And I present that in a very fair fashion to our patients, and people choose what makes sense for them. And either way, I've gotten great results with these, as with other companies.
Yeah. BIA ALCL came in to the scene in 2019, right? Roughly, which is pre-COVID.
Yeah,
right?
Before that, actually, yeah.
So how?
Yeah.
I guess in my head, I'm thinking, how long do you think it's reasonable to? I mean, if it's going to happen with these, it's going to happen, right? I mean, how long of a period of time do you think it would be reasonable to start to be like, okay, we're beyond the possibility of ever seeing that with Motiva?
I think it's very hard to say that, Ify. Exactly. I think, if for that question, I would say, okay, they have been around for longer elsewhere, where there's high level surgery going on. You could say like, okay, it's like so South Korea, so it's high level surgery there, but a lot of parts of Europe. So we've had collectively, there's probably a decade or so, and I haven't seen reports of that. So I think that's for that diagnosis. I would look at that general data and say, okay, I think that's supportive of the fact that this is a different thing. But I think I would still say if someone came in, I would certainly not push someone to use some new thing as like a grail or like a savior of plastic surgery. Yeah. But I think if someone came in to see me and they didn't hear about the new thing that's FDA approved, I've done them a disservice.
Of course.
Yeah. But for me to say this is the only option that exists is also a disservice, in my opinion.
Yeah. Yeah, I'm hearing you loud and clear. In other words, we're not going to push it because it's a new, quote unquote new thing. You're going to have that discussion as you do with most of your patients and go over the options and pick what's best for the patient.
I think so. I totally think so. And I think this is it's unlike other spaces in tech. Like it's not, it's not like an iPhone, or it's not like a cryptocurrency or something where you can't just like move fast and break things with medicine. I think these are people's bodies, right? So I think we need to move carefully with these things, like cautious optimism as we bring these new things in for patients' lives. Again, to say, oh no, it's so new, I don't want to use it, to me, I think it's a disservice, because there are times when I think it does make sense. Like I look at a portfolio of implants, and it's painstaking the way we do this. Every patient, we spend a lot of time with them, talk through what's going on. But ultimately, there are gaps in all these portfolios. Every implant company has a portfolio. It's 4 in the US, 4 companies. And every single one is imperfect in some way. I know this intimately because I've used all 4. I went one for like a few years, the next for a few years. Now, 2 a lot, but so I've used them all like intimately for like, a couple thousand patients. I know this to be true. So, to marry to one, you miss for some patients.
Of course, yeah.
So I think doing that plays like, so for these implants, they have a certain gel type that I feel like will sit very naturally for larger volumes. And so far I've liked that. So if someone says I want to have some high volume implants, but I want it to look natural-ish, it sounds like a parrot, like a
No,
a tradition.
I laugh because I was going to ask you the question, which I might as well ask you now.
Yeah.
What does natural beauty mean to you? If someone said, what is natural beauty? What does that mean to you as a plastic surgeon?
That's a great one. Well, the cheeky answer is to say, no pun intended, is to say God created plastic surgeons, so everything we do is natural. Everything we do is natural.
You have a husband or a partner comes to you and they're like, I want my partner to be a natural beauty like Beyonce or whoever, right? Mm-hmm. So what is natural beauty?
I would say natural beauty is looking like your best self through time. Looking like the best version of yourself through time.
Yeah,
I think it's natural.
I think
it's tough. I think there's probably 2 definitions. There's probably one that's internal and there's one that's external. The one that matters the most is the way you think about yourself,
for sure.
But I think we are social creatures, and so we live in a society, so that matters too. It doesn't matter 0. Like I said, the monk example, like if someone wore like a torn up dress and they walked around, they probably would feel like they were being judged, and they wouldn't do that because that matters. That kind of thing matters. So if someone says, I'm gonna fill my cheeks and it looks like super done, they may feel like that's not great because they're being judged. Does that make sense? So it's a complex thing, but like the way they feel, maybe they want that on the inside, but they don't want to do that. So that natural beauty to me, what wins is how you feel, like looking like your best version of yourself with every given year.
I think of proportion. I think of when I think of natural beauty, I think of proportion, and I think of culture. We're also different people from different parts of the world, which I think makes the world a beautiful place. And we're all supposed to look a certain way. We're not all supposed to look the same, right? And so if you have somebody from country A looking like somebody from country B and the proportions are off, to me now that's not natural. I don't think of something not being natural because you've been touched by whether it's a surgeon's knife or Botox. It could still be natural.
Yes.
That's the way I choose to look at it anyway.
Yeah.
But it means different things to different people. You do have people that, I don't know if that happens here, but I was just talking to a friend of mine the other day, and we're seeing it a lot in our city where women, they just have these lips that are duck-like.
Done.
Super done. And maybe that's natural for them, but I mean,
not to you.
It's not natural. You know what's funny? Like most of my life, I had these lips, right? And I was very conscious of it. And I would talk to people kind of like that. Right?
Really?
Yes. And then I came to this country, and somebody said to me, "Where did you get your lips done?" And I said, "What do you mean?" And they told me. I was like, "Oh my God," And now I look, I'm like, I get it. You can have people that get it injected, and I'm not judging it on it. Just, it looks great, and whatever makes somebody feel good.
Yeah.
Yeah.
Yes.
That's the way I look at it.
I like
it's
that.
Beauty in and beauty out.
I like that. I think one thing I hear about a lot with like natural, some people have they have an aversion to breast implants, for example, because they may say, listen, I want to be natural. I want my breast shape and appearance to change, but I want to be natural. Like, I don't want implants. What options do you have for me? Or I want to, like, whatever it is, I feel like my face is different, but I want to be natural.
But what does that mean?
So that's the thing. It's like so varied. with breast, it's pretty clear. Most people say implants are not natural to them. With face, it's more opaque, right? Because someone says, some have said, they may say, okay, Botox is fine, but I don't want filler. Even though technically filler is a natural substance, right?
Mm-hmm.
But they may just draw that line there. Some may say, I don't want Botox or filler, but can you do like a fat transfer thing? Because that's like my own stuff.
Mm-hmm.
So that definition, I think, is a little bit sharp.
Right.
Everyone has a different take on what natural is. Yeah. My take is like, God made silicone.
It's natural.
God made some engineer who made it.
I'll tell you what. I mean, as somebody that's had two cesareans, someone said to me, "Did you have your child naturally?" I said, "My kids, they're human. Okay, how they came out, natural.
Yeah,
that's the way I look at it.
Yeah,
you know? So, like you said, it's how the person thinks about it.
Yes,
you know?
Yes, absolutely. I agree with you. 100%.
Okay, good. Now, I in time remaining, I do want to talk about this, especially as
how much time? This has gone by so fast.
We're going. Look at
this has been amazing.
20 minutes, so we haven't even touched.
We gotta do like 2 more hours. You gotta come back.
I'm gonna come back. Don't worry.
Have you had our tacos, by the way? Have you had any tacos in Austin? We're known for our tacos and barbecue.
What is with tacos? Everybody's with I don't want tacos.
You gotta. Oh, have you ever had a taco? No. Never. Oh, you gotta.
From where?
We gotta call Tanya Chica.
You gotta hook me up with.
You gotta take out to. I'm gonna plug one company today. And
whoa, this is
other than this people we talked about. But there's a place called Veracruz.
Okay.
You gotta go to Veracruz.
Veracruz.
There's one at the Line Hotel downtown on Congress and Cesar Chavez. Veracruz. They have a steak taco that's to die for.
Okay. How do you deal with scarring, hypertrophy, keloids?
Sure.
Somebody comes to you.
I think a lot about this.
Looking like me. Tell me.
Yeah, so we're talking about just different skin types and scarring potential. So there are certain skin types where there's a more risk of, you could say, the more turbulent healing after plastic surgery, after you make an incision. Okay, so you make a fine line incision somewhere. You hope for a fine line scar. We do a ton in surgery. I had 2 surgeries today, so same thing. They were not highly melanated, but still, same thing. You want to do all you can to minimize the scar appearance, because the scar is the artifact of the surgery. But in the ideal setting, the scar would be a distant memory.
Yeah, look at that.
Yeah.
Camera.
In the ideal setting, the scar will be a forgotten about, ideally fade away completely. So there are certain skin types where I haven't even looked at all day.
I know.
You told me earlier.
No, it's fine. It's still okay. Yeah.
There are certain skin types where there's a higher risk of scarring issues, where the scar can be thicker than we would like, more raised than we would like, or even in some more extreme cases, a straight up keloid, where it's thicker beyond the boundaries of the initial scar. So we do a lot. I certainly do a lot in surgery. So the way to address this in some skin types where there's a higher risk of this, these skin types are people who have an African background, 1. If you have an Asian background, 2. Hispanic, 3. Mediterranean, and some other groups. But those groups, generally, there's a bit of an increased risk, or to a bigger increased risk. There's a family history on top of that. The risk is even higher. So the prep, number 1, before surgery. So usually we'll do, someone comes in, they're going to have a procedure with us. We'll start them with something that's a pigment blocker that's typically off the shelf to help bring down.
That?
So there's a few different products that you can do for this.
Like look at each other.
Yeah.
Like okay.
Yeah. I'm like yeah.
I'm so curious about that.
Yeah. So there are different products that help work with this, but there are different compounds that help decrease melanin production that you can pre-treat the skin with before a procedure. That will help. But this is more of a hyperpigmentation issue than keloid, right? But still, these same groups have a risk of having more pigment laid down after surgery than their native skin. So if someone is whatever skin type or Fitzpatrick skin type, then after a procedure, because of that, the trauma of surgery, their body can make more melanin in those areas than their native skin. And that is undesirable for most people. They want to keep their skin, their complexion, that's what it is, even with what it is. It could be beautiful Sudanese ebony, or it could be Halle Berry-esque cappuccino, or in between. It's all beautiful, but that evenness is the complexion we're talking about, and that can get thrown off in surgery, or from like liposuction or whatever it is. So you can calm that skin down pre-procedure with the melanin blocking topical. There are several options. Some are off the shelf. Prescription is a bit overkill, in my opinion. We can do some of that stuff. That's helpful. I think optimizing the skin to minimize or the tissues to minimize inflammation is very helpful. This is more anecdotal, but if you have a high protein intake, the body will stress out less to rebuild the tissues, number one. If you have the body inflammation calm down, there's hyperbaric oxygen I like to use for our surgeries. Pre-op, patients undergo hyperbaric oxygen, one dive, 5 to 6 days before surgery. And that causes a bump in stem cell count, roughly 5 days post-op. So that, to me, just holistically helps the body get ready for the stress of surgery. And I think, anecdotally, I think that helps us with scar appearance. So when I get into surgery, okay, whatever I'm doing, if today was breast surgery, if it's like tummy surgery or whatever it is, the closure matters. All the choices matter. So tissue trauma matters. So the way I pick up the tissue, if it's super aggressive all the time, all that trauma accumulates and will lead to a worse scar appearance. So you gotta be forceful enough to do the work, but not overly so, and respect the tissues. That's helpful. When I close the area, like I close the breast today on both sides, the layers of closure matter. So you want to take tension off the skin, because skin will respond to tension by stretching. And if that stretch is what the skin cells feel when they make more collagen than they should for a thick scar or wide scar. So if you take tension off with the right suture technique, the right suture material, the right needle on the suture, the right depth of placement, the right layers, the right cadence of sutures, if you gap out a lot, then those gaps, it may look good on the table, but those areas where there's gaps, if you pull the wound across, like I teach people like with me in surgery, if it looks great and you pull and you see little gaps, that's your wide scar right there. So you want to close, so when you pull on the table, there's no gaps.
No gap.
Then you're done with the deep layer. Okay. If not, the scar will widen where those gaps are. It will. It has to, because that's what the body's going to do. On a breast reduction, that's going to be a little bit tight. So, and it takes longer to do this.
So I just want to make sure I understand you. So when you do the closure, you don't want the suturing to be too tight. You want
sutures that are close to each other.
Right.
Because if you don't have them close enough together, you will have spaces.
The gaping.
Yes. Okay. And those areas represent areas of tension where things are going to be pulling.
Okay.
And over time, the scar will widen in those areas.
Interesting.
Or the risk is higher that it will widen in those areas.
And the protein. Too much protein?
It's hard to overdo it peri-op. I like 100 grams a day for most patients. It's hard to overdo protein though, because your body needs that to heal. And this is the other piece that's under discussed. For most of what we do, that we hope to help the body build tissue, surgical or non-surgical. When you get into things like the skin tightening technologies that you can do that are ultrasound based, or even lasers, when you say, oh, you make collagen to do this, rarely do I hear anyone tell the patient or discuss, okay, what's your protein intake?
Right.
Because many of us are undernourished protein wise. This is almost like an epidemic. So if you do a procedure that you want to help your skin build collagen and you have low protein coming in, it's not going to work. Or it'll work poorly. And then you may blame the practice or the physician. But in reality, if you don't have the building blocks, the amino acids contained within, we both know this with doctors, the amino acids are basic. If you're building a brick house, you need a bunch of brick. If you're building human tissue, you need a bunch of amino acids.
Building blocks.
Yes, because without it, you simply, two things will happen. Your body will build regardless. We're designed to do this. But your body will take your muscles, it will scavenge your muscles, so your lean tissue to pull what it needs to rebuild a surgical area, because your body sees trauma. It doesn't know if you got bitten by a tiger, or if you had a breast dog. Your body says, there's trauma, I gotta rebuild this. So to pull from your lean tissue, and your immune cells are low-hanging fruit. They're easy to pull out of circulation and recycle for amino acids. So it sets you up for feeling crummy and for infection.
I like that. I smiled because when I went on your site, there's an obvious attention to skin. It's not just surgery. And correct me if I'm wrong, I think I'm starting to understand why you call the plastic a 360. Because it's not just, at least to me anyway, that's I'm getting. Because I noticed that you do have a particular attention to skin. You have a 360 skin education, right? So how
we have a skincare line,
exactly how to make it better, and it all ties in, and becomes a perfect.
That's our mission,
right?
The company, it is our mission.
Yeah, I love that. Okay, cool. That makes sense. I love that. I love that answer. That there are options, because I've talked to some people and it's like, well, there's really nothing that you can do. Scarring is scarring.
And there's a lot you can do. And then even so, like I did again, this is routine. I did this today. After I've closed everything, there's multi-layer closure. And then in a lot of cases, I will inject a dilute triamcinolone steroid solution on the table in my closure.
Really?
Yeah, I did it today. So
make me want to come and see you.
To calm, thank you. That further calms down these cells that may be overly exuberant in their collagen production at the scar layer. And then we do like a very intense silicone regimen afterwards.
Yeah, what is it? Because that's the only thing I have ever heard is the silicone sheets.
Yes.
Yeah.
Silicone is the single best thing you can do to a healing incision post-op, evidence-based, to help control scar appearance. If you have to do one thing, it's a silicone product. It can be a sheet, it can be a gel, but that occlusion of the incision closure with silicone and the hydration that results afterwards have been shown to really optimize scar appearance. So I advocate for silicone afterwards. There are a few ways you can do this. The silicone gel tapes. The tape I like to do early on for the first month or so after we take the surgical tape off. And then most people will say do like months of tape, which is okay, but then you have to be pragmatic about this. We live in Austin, okay? So someone gets a breast reduction, like we did an implant exchange and a lift today, but similar incision pattern. When you get past a month, do you expect anyone reasonable to put these tape on in 90-degree weather every day for months and months? No one's going to do this, right? So I push for the tape for the first month, and then we switch to a silicone gel because compliance is way higher with the gel in our part of the world. If you live in somewhere where like it's probably cold a lot, the tape may fly for like 3 months, 4 months, 5 months. But for us, compliance will be lower. So the gel is easy. You take that, you apply it, and then you go on about your day. And so after the first month or so, again, we switch our folks to a gel. And that has been a nice compromise for our practice. And then on top of that, you can do injections post-op in clinic. There are lasers you can do that we offer to help optimize scar appearance.
That's cool. Okay. We have a bit of time. I know you just came back from Nigeria.
Yes, I did.
We talked about
Amazing.
that.
And Ghana.
Our
crown, nigga.
Right. Yeah, I've never been to Ghana. I want to go to Ghana. Amazing.
It was my first time. It was amazing.
Yeah, I've heard amazing.
Accra was great anyway.
Yeah.
That's all I saw.
Can we talk about potential for surgery? I mean, you did touch on it a little bit.
Yeah.
You're thinking of doing some surgery there?
Yeah, I mean, it was attractive. It's attractive, man. I mean, so I grew up in Nigeria, so it's home. But I've been gone from home for a long time. I did go back to Nigeria. I went back in 2007, and I saw my grandfather before he passed the year after.
That was the last time you were there. It was 2000.
No. So I went back in 2018.
We were there.
Or 19.
Okay, because we were there.
18 it was. 18, 19 was Korea. So 18 on a medical mission.
Okay.
So I went there. That was beautiful. My mom and I did it together. We did it with a group called AMPA.
Okay.
AMPA is the American... No. Association of Nigerian Physicians in the Americas. I think it includes Canada as well. It's only the US.
I haven't heard of it.
Excuse me. So that was a beautiful trip, but it was a long time ago. This trip was more, it was mixed personal professional, but the aspect of it that was professional was beautiful because I saw some concepts of how practice could work in on the continent. I visited a practice in Accra that was not plastic surgery, but a different specialty. But it was someone who set up a practice from the U.S. In Ghana, which is very nice to see. And then in Lagos, I visited a friend who's a plastic surgeon I mentioned earlier in Ikoyi.
You were mentioning, did that person train?
He trained in Nigeria, but he came and he did, in Nigeria. He did kind of a fellowship in the U.S., an observership more.
Okay.
But he set up in Ikoyi, and that was also very nice. And so in terms of, those gears were turning for sure. I mean, obviously, I have a priority with my practice in Austin.
Here.
Busy, and it's young too. It's 2 years old, so that's caught my attention for a while. But certainly, when I look at the continent of Africa and Nigeria for sure, and even Ghana, and I see what's possible there, I think it has me thinking about some things for sure.
Yeah, I think of going back and they're doing a lecture or something. It's hard in my world with all the equipment and the need for constant electricity.
Yeah,
start and stop an MR machine, and
yes.
So there's definite limitations in that regard. But I think about it and just giving back a bit.
It is. But I remain optimistic about So certainly, I'm very optimistic about just Nigeria. I'll speak about Nigeria because I know Nigeria, but I don't know anywhere else. But I'm infinitely optimistic about Nigerian intellect, Nigerian know-how, Nigerian talent,
of course,
Nigerian smarts. Infinitely so. I think that my observation, having lived in Nigeria for a long enough time, and being exposed to it, is the country itself is catching up to the people's potential. Like, the people are world class, always have been, but the country itself has had struggles and is moving along. Maybe the pace isn't what we would like. We wish we were faster, but I think there's progress being made in pockets where it's moving to catch up with the people's brilliance.
That's good to know.
And so when it'll get there, I don't know, but
slowly but surely.
Slowly, and then what's our role as people who are Nigerian, what's our role in that versus our parents' role versus our kids' role? That book is still being written. But to me, I see a people who are amazing and a country that is catching up to that.
That's awesome. I love it. Okay. Just an ending. Actually, I need to ask this question. Do you have discussions with your patients about imaging, breast imaging?
I do. I do.
Radiologist, I'm gonna ask that.
Sure. No, of course. No. It's not. Let's see. So when does it come up? It's not as a matter of routine, I would say. Now, is that because I'm in a space where I happen to be where I live in Austin. Most people I see have a primary care person. If they're for us 40, they are plugged in. They're doing this, but the vast majority. So I'm not having a checklist out.
Okay.
And that's a privileged position.
Yeah.
Not saying it's not important, it is, but I don't routinely ask folks. If there's some issue where we've had surgery or we're gonna have surgery and there's some concern, then yes, I a lot of times I'll have people write for imaging.
Okay.
And then for whatever it is, ultrasound, MRI.
And that was the point, is just, I just wanted women, because I do see women that come in with implants and they don't want to have a mammogram because they're worried about this being ruptured. This is so durable, and I mentioned that because we can find early cancer through calcifications, and we only see it on mammograms. And if we do ultrasound, then we'll see something, but it's a mass, and we've missed the opportunity to find a pre-cancer, right? So I was telling women with implants, you still have the same risk as others of, to have a malignancy, and to make sure that you get screened because it's important.
Oh yeah, I mean, I definitely don't discourage imaging. And some women will tell me, that an MRI is very uncomfortable, which it is. You know, the way you have to do an MRI.
You had to lay
Yeah.
prone and yeah.
And even the even the mammograms, is it's very tech dependent. You know, it's we call them Eklund views.
Yeah.
Yeah.
Implant
So,
displacement recommend, yeah.
yeah. So someone will report that it's like, you know, it's uncomfortable, and someone, you know, is rough.
There's less compression with mammograms actually. But yeah, I do agree. In my practice in Canada, we do a lot of implants and there's less compression, and it is sometimes dependent. It shouldn't be, but it depends on where you go as well.
Yeah.
As long as women get it done, that's
No,
what I'm preaching.
Absolutely.
Because it's important.
Yes. We didn't talk about BIA ALCL that much.
We did sort of talk about the BIA
did
ALCL
a
with
little bit,
Motiva
yeah.
implants, right? But what I did not talk about is the breast implant related illness.
Yeah.
Have there been any studies done with the Motiva implants, or what's been your
experience and
your experience?
Yeah. I love what you said that, by the way, breast implant related illness. I love that because people will say BII a lot.
Yeah.
And I'm not convinced it's a breast implant illness. It's certainly a breast implant associated illness, but I love the way the R you put in there is great. It's perfect.
Yeah.
So it's a very serious thing, right? So, but what is it exactly? I think it's a little bit unclear.
Yeah.
But we're gonna try to shed some light on it today. So BIAI or RI is a condition where some women will have a history of breast implants in place and present with symptoms that include any of a number of the following. So fatigue, let's look this way, muscle fatigue, muscle aches, myalgias, brain fog, general sense of malaise that typically would then be worked up by a physician and be a negative workup. And so nothing is left to basically diagnose but this history of breast implants after they've been worked up fully. And then in some of these women, a subset, implants are removed and then they feel better. Not all, certainly. We've seen this with silicone implants, saline implants, smooth implants, textured implants. It's across the board. So it appears to be you can argue the shell is a silicone shell, but this is a very inert structure that exists in different implants in medicine in general. So it's not a fill. We don't know what it is. There are studies that make it even further more confusing. There's a big Scandinavian study where 2 groups of women were looked at, a couple of thousand per group. A couple of thousand had breast implant surgery, implants, lifts, etc. And a couple of thousand had a breast surgery that was no implants, reduction and lift. And there was higher in this group, but there was a non-zero group of women who had this same type of symptoms post-op. So is it a post-surgical thing? Maybe turbocharged by implants in some women? It's unclear what the picture is, but nonetheless, it's a very serious thing, and it happens in some women. Now, the big question is, how do you counsel someone who is considering breast implants, who walks somewhere? Because they ask all the time.
Yeah.
Like, what are your thoughts about this? So the best numbers we have are that they're probably, if you go aggressive, maybe 10,000
in the world,
in the US, women who have true breast implant associated illness, where like they have issues, implant comes out, they get better.
That's fine.
Let's say 10,000,
Okay.
or let's say 20,000.
Okay.
Very serious and real, and that's where it is. Okay. So someone says, I want to get a breast dog. Then this is where we get into our counseling of patients and the motivation for surgery and why are we doing this. Because it's also true that there are several million women, and I see this on a daily basis, who have had implants, who have no issues, who have dramatically improved lives. Millions and a couple of tens of thousands.
10, 20, yeah.
So it now becomes incumbent upon the person to now assess that for herself, to say, okay, like, is it worth it to me to do this? And the best analogy I give our folks is this driving analogy. So I see people get in cars and people die every day, unfortunately, in cars. But I still hop in the car with my 3-year-old and my 9-year-old, and I go take them to school, and I go to work, and I go see my mom in Dallas. Not because I'm crazy I want to die, but because I assess the risk in my mind and say
Right.
it's very unlikely I'll have a problem. It's possible, but I go and you drive
No.
and we fly. You know, so when people say I don't want to drive ever, like the Amish, they don't want to drive. No, and it's how, but it's true,
Yeah.
and that's fine. And they have it seems like great lives, but they don't want to drive. It's fine, but I want to drive, even though I know it's possible. So that's how I think.
Weigh the risk versus the
Yeah.
benefits.
So if someone says this, like I have a family history of like a lot of inflammation issues, I don't want to do it. That's fair. We can talk about fat transfer. Most people don't have that history, and we said earlier, nothing else that we know of brings that structure to the breast. So someone said, I've got postpartum atrophy. I want to rebuild this because whatever the reason it is, I want to be my best self. Then most people say millions to me, I want to do it. Some may not. And the beauty of this is it's totally fine either way.
Yeah.
You know,
Yeah, that's interesting. Yeah. It's
not to soapbox this, but I think
no, I actually I think you said it all. There's really not much else to say. Yeah, and it is what it is. Chike, are you okay? Okay. Yeah. Okay. We're almost
do
done.
you have any comments?
I'm just checking to see if you're okay. Okay. Now, just in closing, I want
Is it interesting? I should ask her. You can edit this out.
Of course.
Is it interesting or is it boring?
Of course, it's interesting.
Good.
Good answer. Okay, just in the final segments.
Yes.
Let's see. First of all, what do you find most rewarding about your work? What you do? We'll try and keep it short.
Yeah.
'Cause I know-
Yeah. No,
I think that's
no.
size
Yeah.
said it all.
No. There's a lot to this. I mean, it's an amazing space to be in. It's truly a privilege to do it. It really is. The single best thing is definitely when I hear feedback about the impact.
Okay.
I shared one anecdote earlier about a 13-year-old boy, etc. Someone said about a 13-year-old boy, she had a breast.
Oh, right. Yes. Yeah.
That kind of feedback to me gives me an insight into what this is actually doing in people's lives. There's a couple I'll share with you real quick. So someone was in her 60s. I've known her in the family for a long time. We did a tummy tuck and some breast stuff too. But the tummy tuck was transformative. And so she was like, man, after like a few months, she was like, I had my kids and the kids are grown, and I put myself off for like a long time, and now I'm in my 60s and I did this. This is like a new rebirth. She's like, and then she said the big thing. She said, I thought I was gonna have to wear print dresses for the rest of my life.
Oh. Not that there's anything wrong with print dresses, but I totally understand that.
Right? So this
Yeah.
is like her body was so that to me, and as a man, I'm not a woman, right? So, but that kind of comment gives me deep insights into like, you know what I'm saying? This is like a very accomplished person who we talked about how you go to the world. It was like a prison sentence for her.
You have to always pick and choose what you're wearing and so
yeah.
distract her.
So it's hard. Yes.
Yeah.
Yes.
Yes.
So it's hard to top that kind of thing in terms of fulfillment. So, and then the other one that's kind of recently, someone came in and she's very dynamic, runs a company, has family, like she's it. And we did a breast thing, and afterwards we're talking like a couple of months out, and she was like, "This like changed my life." I was like, "Really?"
Tell me more.
Yeah.
Why don't you?
She was like, "No, you don't understand." She said, "Well, I threw away my bottle of antidepressants
Oh,
that I've had for years.
yeah.
So post this breast so-called Bane thing, like she took this thing and she just threw it away.
Yeah.
She was done with it. So, I mean,
I love
like,
that. I
it's
love
crazy.
hearing that. It just shows that mind-body connection and doing what you need to do if you can do it to fix it.
Yeah.
Yeah.
And even her, she I don't think she realized when she was saying I'm going to do a breast thing, she didn't realize the impact it would have on her life. She didn't. If she did, she would have done it years ago,
Of course.
right? But so that kind of a thing is it's almost impossible to. So if someone ever says, or they troll Kylie online or whatever, it's like,
Exactly. I love
this
it.
this is the side that I see,
Mhm.
and so so it's dramatic, man.
Yeah.
So
Okay,
it's really it's a very cool thing.
Okay, well, I know we didn't get, like you said, I have to come back. We didn't have to talk about skin too much,
When we
but
gotta schedule it.
we'll have to schedule it. Don't worry.
Yeah,
I
Chika,
mean, I
book it.
come here all the time. I mean, what is one skincare product that you use daily? And if someone said to you, what is one skincare product that we can be like, you know what, this just needs to go? What would that be?
It needs to go. Like
Go. Just
like
we need to get rid of it.
get
We're
rid
going
of
down
it?
there. What do you use daily?
okay.
I know just
Um,
tell me like moisturizer because
Oh yeah, just basic. Okay, so don't say moisturizer.
don't just say like
well.
give me more than moisturizer.
well,
I know you do use moisturizer daily,
Listen,
maybe.
so we have an amazing skincare line at our practice.
Yes.
So
What's in it?
I won't plug that too much because like that's
No,
like,
I want you to. I mean,
Okay.
I'm not being facetious because I think personally, if I put my name to something,
Mhm.
then I believe in it.
I do, and we do deeply.
Right.
You know.
So tell me about your skincare product. Yeah.
Okay, I'll tell you all about 360 skincare.
Okay.
But first, I'll answer your question. So I think the one thing that everyone must the single most important thing that is restorative for the skin is some form of a retinol.
Oh my God, I was going to ask you about
Right.
this. Okay,
Yeah.
why?
Why? Because so those compounds, they're like vitamin A derivatives,
Yeah.
and long story short, they kind of rev up the skin's turnover cycle of how the skin cells turn. So the skin on the surface right now, what you're looking at from at baseline is like dead stuff. Okay, the top layer of the skin is like a layer of dead skin, and then just a couple of skin cell layers, and then there's like some live stuff, and then like, that kind of thing. So we're constantly shedding,
Okay.
like snakes almost. And that rate speeds up when you have a retinol in place. So the stuff you're seeing is fresher and and more vibrant. Basically, is how it works.
So a topical retinoid
Yes.
and vitamin C.
So okay, so that's a separate.
Okay.
So the retinol is a vitamin A derivative. So that
Okay.
if you did a retinoid is usually prescription strength. A retinol is usually something you find over the counter, a little weaker than a retinoid, but they do kind of the same thing. Most people aren't doing a prescription strength thing.
So you're saying retinoid is good.
Either one is good.
Okay.
If someone has like medical issues,
Mm-hmm.
they may get a prescription from the dermatologist of a retinoid that's stronger at doing this. Most people who don't have an issue will buy off the shelf a nice retinol to get these goals accomplished.
And
What
how old should you be to start using
How old?
retinoid? Yeah.
I mean, if you're over 18,
Really?
yeah, it's fine. Yeah. And so usually it's a nighttime thing that you do.
Okay.
Because if you it sensitizes the skin, so if the sun hits it,
Yeah.
people can flush. Some skin types you can get flushing and irritation and things. So it's a nighttime thing that you do. But if you did that alone, if skincare was some kind of a class, that would be like an A minus.
Okay.
That by itself.
Okay.
And then you're basically passing.
Tanya, we're gonna be retinoid check. Okay.
Yeah. So you do that, and I say that before talking about sunscreen because that's like kind of an obvious. You want to
Yeah.
protect your skin, and that's like a whole discussion. Do you do a chemical block or like a physical block? The physical block is safer generally, viewed that way, and they're more reliable. But sunscreen, it goes without saying. But in terms of like, the restorative stuff, the one thing you really want to do is a retinol if your body will tolerate it, and the off the shelf ones are well tolerated. And then you get into the regimen. Do you do it, every day or like 3 times a week? And you can titrate that down. If you do too much, it can irritate the skin a bit.
Okay.
So that's what I would do. You said vitamin C, which is
Yeah.
nice. It's an antioxidant. That's like probably the next important thing is an antioxidant. Vitamin C is the best one. Why is that important? It basically essentially, so if you think of your skin cells as like something like a house or something, and then people live in the house and they make a bunch of trash, right? Because they just generate trash.
Yeah.
If there's no trash collector to show up, it just builds up. And at some point, it could be months, it could be days, it becomes a mess. So vitamin C is the trash collector. So it comes in and takes damage and free radicals out of the house so you can live your normal life and not have stuff everywhere. That's what it does. So ultraviolet light will cause damage in the skin, and the body can clear it up some on its way, but vitamin C is a scavenger of free radicals. So it pulls all that damaged stuff. Because if not, it just causes more damage and more disruption in the house.
Okay, what are we getting rid of?
It depends on what the right. So I mean, I don't know what the throwaway is. I mean, I think
Collagen?
Oh no. I said I'm not sure what the throwaway is. It depends on what your regimen is. Like, I think generally alcohol-containing things are not so good. So if you have a wash, alcohol-based, or like a toner, alcohol-based, I'll probably avoid because it's kind of harsh on the skin. So alcohol-containing topicals I would avoid in general.
Okay.
But skin is a whole discussion we could talk about forever.
I know, and that's why I said we are just gonna have to do that another time. How do you decompress?
So I mean, sauna actually.
Sauna?
Yeah, sauna. Yeah,
Okay.
yeah. I have a gym I go to. It's a very nice gym, and they have the gym itself is decompressive.
Infrared?
Yeah, it's a dry barrel sauna. It's like it's a dry old school.
Okay.
So the gym itself is restorative for me.
Yeah.
And my gym has a sauna, so I'll do.
You love it.
Yeah, that's great. So I'll do it's like 200 degrees, Fahrenheit, which is I don't know what it is, Celsius, but it's hot as hell.
Yeah.
And then I'll do I'll do that, and I'll do 4 times a week, 5 times a week usually.
Really? For how long a session?
15-20 minutes. So yesterday I was a little short because I was tight, but 20 minutes.
Okay. Awesome.
And then sometimes I'll do a cold plunge as well.
Oh.
And the same session it's called contrast therapy. You go back and forth.
Okay. Cool.
But sauna is fantastic for many reasons. You get toxins that your body lets go of. And it does basically there's no way so your blood vessels are made of muscle, right? Smooth muscle. There's no great way to exercise. Muscles should be worked out. There's no good way to exercise your blood vessel musculature other than sauna therapy. Why? When you go into that extreme heat, they expand.
Yeah.
So when you do that back and forth, you get the compliance of the vessels is improved.
Right.
So things that would ordinarily cause them to become stiff or brittle, you fight that with sauna therapy.
I never really thought about that, but that makes sense.
It's massive. So the Scandinavians have known this for a long time. That's why for the centuries, I think they've done every house has a sauna and stuff.
Yeah.
But that's a huge benefit of sauna therapy. So I'd advocate everyone do it.
I love that. Okay, there you go. Dr. Chike-Obi.
And it's tied to
sauna therapy.
It's big.
Very
And
important.
it works for me.
Okay, awesome.
How do you decompress?
Oh my gosh. This is your question for me.
Yes, it's one of them.
Bunch of things. Well, I love to work out.
Okay.
Nice. That is my peace and zen. Gotta lift weights. I teach spin actually.
What are you doing?
Yeah. And it's a form of therapy mentally as well for me. Yeah. And
Spin is intense.
and I love it. I love
I took a class one time. I was like, never again.
Oh really? Oh,
She beat me up.
it's
and
so
she
good.
wore me out.
But you know the thing, people go and spin and they give your all at once. You have to kind of slow it.
Really?
Yeah.
She beat me up. This day she was on something, I swear, because she did the class.
Maybe she was working something out.
She did the class, and I was dying. And then right afterwards, she's like, "All right, class 2, let's go." I was like,
I've taught 2 classes back to back.
"What are you smoking, man?" I was like, "I'm gonna go
No,
keel over the corner and die."
it's endurance, but it's so good.
Yeah, it's exhilarating for you.
Yeah.
So
Yeah, and family.
I see a place.
Those are my decompressors.
I love that. I love
Okay. Awesome. Now, behind every great man is a great woman. So this is your moment to tell us about that great woman as much as
Oh my God.
you.
Oh, rather, behind every man, every supposed great man is a woman shaking her head. That's what have you heard this? and rolling her eyes. And rolling her eyes.
No, we're in support.
No,
Tell us about your beautiful half.
So Dara, my wife Dara is amazing. Amazing. I mean, I can't even tell you the extent of it.
I can see your eyes light up. I love it.
Oh yeah.
That's wonderful.
Yeah, and we had a great trip in Nigeria too. But no, so my wife is we met we got married in 2013.
Okay.
We met 3 years before that.
Okay.
Nigerian background as well.
Okay.
And no, she's great, man. She's she's just a powerhouse. I mean, and you meet her and talk with her.
Oh, I love to.
Yeah. So she's your mother of beautiful children, a great partner, with everything. Just a force to be reckoned with. So professionally, what she's doing now is super cool. You'll like this. So she has basically she has this platform she's building that is speaking directly to women of color, basically in their 40s, but wider than that, for aesthetics.
Oh,
right?
Beautiful.
Yeah. She does consult with us at our practice. She sees basically perspectives come in.
Okay.
She'll welcome them and explain our process, our practice, my work, my approach, and then I meet them right afterwards, and then we talk about plans and things. But she's identified what she's noticed is a need where women of color are maybe not spoken to as loudly about some of these opportunities in aesthetics that are amazing, and our practice is essentially it's a colorblind practice, but we can notice that there are some gaps
for sure,
and as a family address them even within the structure of our practice. So she started doing that about a month ago. On TikTok and having content out there talking about these issues.
Talk to her.
Yeah.
That's wonderful.
Yeah, that kind of thing. So, but in terms of her overall presence in the household, it's hugely not lucky you said that, but like a fortunate thing that our paths cross.
That's
wonderful. And we have a beautiful union and beautiful kids that we're raising.
It's awesome. It's meant to be.
That kind of thing. Yeah.
I always ask that question because we talked about earlier people wanting to go into medicine, and I think that medicine is very hard nowadays, and first of all you have to have that passion for it, and in order to get to it you have to have a strong foundation from family. And it's so important. So whoever you choose, just make sure that that's strong, because no matter what happens in the day, you can always go back to that person and they've got you.
Yeah, I think having that understanding is important, and it just like any marriage, it just takes time to get there. I don't think there's any easy. Just like I've learned, a normal family is a fiction, right? There's no normal family. Every family has there's kinks, there's complications, there's difficulties. I think every marriage...
That's a normal family.
Yeah, right, exactly. Yeah. We can redefine it.
That is a normal family.
Yes. I think marriage is similar. Like, there's no easy marriage be past a couple of days. It's easy for a day. But then you work through things and like figure out to communicate. That kind of thing, I think, is all that work.
Takes work.
If you're lucky, it manifests in some in beauty.
Yes.
But
that's another form of beauty right there.
But it's I think it's all work. Life is all like work. It's like parenting, marriage, running a practice. Nothing is easy.
No.
But the beauty is in that labor.
Yeah.
Climbing a mountain.
Yes, I agree. Okay. So I know we can find you at 360 Plastic Surgery.
I asked you a question. I had a question to ask you.
Oh, right. You have a...
Kind of wrap up. I didn't forget.
Okay, what question do you have for me? Oh, my goodness.
Yes. Sure. So I have a lot of questions, but I'll ask one.
You can even ask two.
Well, I just want... So
okay.
So the mission of the podcast. Why the podcast?
Oh, that's a loaded question. Good question. I have been in practice for over 20 years. And I love what I do. I love teaching. And I worked for a very long time without having a voice. I wasn't allowed to have a voice. And I went through some things where I'm a very extroverted person, just a lot of personality. And I couldn't be myself. I wasn't allowed to be myself. And it led to a process where, you know, that job was gone, I moved on. And in the process of losing that job and going through a bunch of jobs to where I am right now, I discovered me. I discovered that, you know what, I'm good at what I do. You know, everywhere I went to had something to say about me that I forgot to see. I couldn't see. I wasn't allowed to see. And so now that I've gone through the work, I've gone through the therapy, and to where I am right now, it's important for me to use my voice to bring attention to breast imaging, to women, to women of color, to people that are going through something, to, you know what, it's okay. You may go through it and you're going to get through it. And so it's my moment now to be like, you know what, I've got that voice, I'm reclaiming it. And I'm a very curious person. It's not just breast imaging. You know, there's people say, oh, what defines you? I don't know. Like, I have so many interests. And in doing this podcast, I'm able to meet different people and talk to different people and learn so much. And in turn, be able to impart it to the world, you know, in this forum. And that is why.
I love that. It's great. Yeah, well, your voice is very powerful. And it's an honor to meet you and to do this. And hopefully we'll do more of it.
I know that we will. Absolutely. Thank you very much.
Of course.
Yeah. So that's my time with Dr. Chike-Obi, and we use a lot of time, and I'm super, super grateful. You can find him at 4004 Marathon Boulevard, 360 Plastic Surgery. And I know that you have the ability to book online as well.
Yes.
So I love that we could do this. I know that from the moment we connected, the process of arranging this, Camille, the conversations that I'm not just saying it. I know we're lifelong friends now. You know, I was talking to I was talking to Chika. She goes, hey, he's going to be our brother.
That's right. I'm honored again. It's great.
Because, you know, we just have 2. So now.
3.
And you've got 7 sisters now.
Yes. Oh.
So there you go.
More than Mary. I love that.
More than you are bargaining.
Can't wait to meet them.
Yeah. And, you know, I mentioned before, like one of the reels mentioned that you're as talented as you're down to earth. And I can say that with absolute certainty. When I first talked to you, I called my sister and I said, I can palpate, I can feel how important what you do is to you and what your patients mean to you. You know, like, and I'm just saying that I'm not just saying that, I really mean it. Like, I could feel that, right? And so in this day and age, that word service, you hardly get it. Mm-hmm. So when you meet people like you, it stands out, you know, and so I'm hoping that people listen to this and come and find you, because I know you're excellent at what you do, and I wish you all the best in all your endeavors here and internationally, and I look forward to when we're gonna meet the next time.
Thank you. It's very kind of you. I don't do a lot of I'm not on camera a lot, actually, for whatever reason, but your platform to me was very compelling, and you were compelling when we talked, and I think people who like look for what you're doing are people who are truly like trying to find some truth. I can tell. So I'm very happy to be involved, and I think it's if it hits the right ears, then that's amazing.
Thank you.
If it's like a million or one, you know,
yes.
it kind of doesn't. That's almost irrelevant, actually.
And that's the way I feel about it. If I can make a difference in one person's life, there's somebody sitting there probably that maybe, especially as maybe an African, Nigerian, you know, woman, man that wants to have plastic surgery, but they feel, I can't do that because I'm going to be judged. Mm-hmm. Go see him.
Yeah, it's okay.
Yeah, it's okay.
You can do it.
You can do it. Absolutely. Okay. Well, thank you very much.
And they can judge. It's okay.
It's okay too.
Do it anyway.
We got this. Awesome. Okay, right here.
Thank you so much.